Dental misinformation is spreading fast across social media, and it's challenging evidence-based care. Hello, everybody. I'm Dr. Effie Ioannidou.
Hey, you guys. I am Dr. Arnell Wright. And today, how to talk to your patients all about misinformation is what we're going to be covering. And we want to counter the noise with science, empathy, and facts. So let's go.
From the American Dental Association, this is Dental Soundbites, created for dentists by dentists. Ready? Let's dive right into real talk on dentistry's daily wins and sticky situations.
Hello, everybody. Today, we will talk about dental misinformation that is sprouting and spreading around social media.
Hello. Well, yes, social media can really be a great place to get new tips and tricks, but that doesn't always mean that the information is endorsed by dental professionals. I'm really looking forward to talking with our guests about this and most importantly, getting tips on how to advise our patients about the dental trends that they are seeing on social media.
Today, our special guest is no stranger to social media. In fact, she is using her digital platforms to educate, to influence, to debunk misinformation, and to debunk myths. I love it.
Yay.
Let me show you some examples of how she is tackling this head on.
Hi, I'm Dr. Quartey. Word on the TikTok streets, if there's another trend. So let's talk about teeth whitening. If you've been left behind by a do-it-yourself company, dentists are here to help.
I love it. Oh my gosh.
So I love it. I really love it.
Yay. Oh, well, let's go ahead and get into the show. Let's welcome Dr. Tricia Quartey-Sagaille.
Thank you so much.
Welcome.
Thank you guys for having me. I appreciate it.
Oh, we have so much to discuss and to analyze about misinformation, about social media. But before we do this, let's get to start knowing you a little bit more. So tell our audience about yourself and speak a little bit about your background.
Yep. So I am a general dentist. I own a practice in Brooklyn, New York. I have a few associates and some specialists who work for me. We've been on social media for years, but when we started to realize, wow, a lot of patients are finding us this way. So we started to realize they love our dancing videos. And from there, we would just throw in the education as well.
The dancing videos are amazing. Oh my gosh.
You seem super young. So tell us, when did you graduate dental school? How many years have you been practicing?
Oh, sure. I graduated from University of Medicine and Dentistry of New Jersey in 2009. So maybe I'm a little older.
Oh, no, look at you. You have been
such
around
a young face.
For a long time, but yet you have this energy of like,
It's giving youthful.
I applaud this. Good for you.
Thank you. My knees speak my age.
I love that. I love it. Okay, so we got to see that insert, and I definitely think that all of our viewers and our listeners are going to have such a good time hearing about some of the misinformation that you're going to share on today's episode. So right now, that misinformation and some of the topics, they're both surprising and concerning. Can you start by sharing with us what are the most common dental myths that you're seeing being circulated online?
Yeah, I'm seeing oil pulling. So swishing with different types of oils, anywhere from 10 to 20 minutes, but they're using it as a way to reverse gum issues and reverse cavities.
What exactly is oil pulling or what, like just kind of defining those things? Like how do you do it or whatever? I guess you talked about it 15 minutes, placing a scoop of coconut oil, right?
Yep. Coconut oil. I've seen olive oil. I've seen, I think, sunflower oil. But yeah, taking a teaspoon, swishing it for 20 minutes, 10 to 20 minutes. Yeah, that's the oil pulling. Mm-hmm.
Yeah. You know what? Side note, you all, I tried oil pulling at one time and I couldn't take it. I was just like, what is this? This is crazy. How do people, I don't even know how you build up a tolerance to it.
I mean, it takes a long time for 15, 20 minutes. It's a long time to do anything.
That's a lot.
But our concern is that people think I'm going to reverse the decay on my tooth by oil pulling.
If this hypothesis was correct, then not a single Greek person would have cavities. So, and I can tell you that's not a reality. Epidemiology shows that there is a high prevalence of both caries and periodontal disease in the South Mediterranean that is filled and, with olive oil, and everybody's pulling and doing all this magic. But yes, so yeah, for sure. But what else besides this? What else are you seeing? Like, is this the highest trend, you think, the oil pulling?
Is it still a big thing too?
I'm still seeing it. Yes,
crazy.
I am still seeing it.
Oh, wow.
And I'm seeing charcoal toothpaste as a way to whiten your teeth. I'm seeing that on the counters. I'm seeing it everywhere. And our biggest concern is, they're removing a layer of their enamel, so it looks whiter. It does.
Yeah.
Over time, they're doing that. They're the veneer technicians. Getting veneers from non-dental professionals. Other do-it-yourself dentistry. The fitness chewing gum. So chewing gum as a way to sculpt your jawline.
Your jaws. I did see that.
I have never seen that.
I did see that. That's very true. Yes. And I was just like, what?
Yeah. Yes.
Is there a certain kind of gum? Can you go into a little bit more of that?
What I have seen was a gum that was advertised to do this, like a specific gum used for this. Yes.
Okay.
And to chew this gum as a way to sculpt that jawline that you've always wanted.
Oh my gosh. Is it mainly in men? I'm sorry. I'm into this a little bit too much.
I've seen men and women.
Okay.
Yeah.
I was going to say the
both.
reason why is because I just started making an appearance on TikTok, and I feel like I don't see a lot of these trends on Instagram. But when I scroll through TikTok, I'm like, oh my gosh, this is where I don't know what it all is, but I don't know. You're the expert. You have to tell us.
Yeah. I'm seeing a lot of it on TikTok. I'm seeing a lot of the facial fitness gums, both men and women. Yeah, they're using it.
And so wait, let me understand this. So when we chew the gum to what? To change the lower
change the jawline,
inferior line of our jaw.
Yeah, and I think in some situations they're trying to increase the size of their masseter muscles as a way to sculpt their jawline. I know. I mean, for me, I just think about all of the issues, the fatigue that can happen from using it. But that one was one that was very popular at one point.
So this is basically the biological hypothesis, if any, or plausibility behind this. It's just it's an exercise, right?
Yes.
It's advertised as a exercise of the facial muscles.
Yes, exactly.
The masseter, the fitness, right? Yeah.
Fitness gum, yes, to help sculpt.
Okay, so it's not like remodeling the actual bone architecture.
No.
It's just exercising because, from fitness to the jawline, there is a huge space, right?
For sure.
So it makes me wonder, where do you, based on all your research that you do online and the access to all these different social media platforms, where do you think that this misinformation comes from? Is it like myths among patients promoted by certain companies? And how do you think the social media play a role on this? Obviously, we know the University of Facebook is, a very well accredited university.
Oh, for sure. Well, there were a few topics that I forgot to talk about or that I missed talking about, which was like Ozempic tongue. Have you heard about Ozempic tongue?
I saw that. So that's a trend?
Well, it's not a trend, but it's something that you're seeing.
So what is it? Tell us what it is.
Yeah, so it's for people that are using Ozempic. Ozempic is very popular now. They are seeing a metallic taste or different changes on their tongue. And as dentists, we're just concerned that maybe this is signs of dry mouth. So, of course, we're always super duper concerned about dry mouth. But Ozempic tongue is one that I've seen. And then the one that we all know about is fluoride. Community water fluoridation, fluoride supplements.
Yes. This is a long-term battle.
Long-term.
Yeah.
Where do you think, in your opinion, where do you think this misinformation comes from? Is this something that is generated among people, or you think it's something that is, plain promotion tactics from certain companies for, depending on the product that is being promoted, obviously. And why do you think social media is the easy platform that those types of misinformation can be promoted on?
Well, I think misinformation, like you said, spreads faster than the truth. Mm-hmm. I think it comes a lot from content creators who are trying to increase their likes, their views. That's the name of the game with content creators, is to go viral. And sometimes it's not a matter of it's truthful or not, but it's what's going to make them go viral. And then I do think sometimes they are promoting a product. I think that sometimes there is somebody that maybe who has paid them to promote a certain product. And I think the name of the game is really views, money. How can you go viral? I know as a way to, make a living.
Yeah, it's like a new business.
But it's interesting because if you look at the trends, like what you mentioned, and again, I'm no expert on misinformation, but there are certain trends, right? The oil pulling, for example. I mean, there is no product. There is no. It doesn't associate with, to my knowledge at least, to the promotion of any product. Right? It's just a myth.
Yeah, oil pulling is a myth, but from the myth, I have seen companies make products specifically for oil pulling.
Interesting.
Yeah.
Yes, this is a good place for us to go. That's very good. I was going to say earlier, sorry to interject, I can get so excited. So whenever I'm perusing or browsing down like Ross or even like Walmart, in any store, I see like different brands that have their own branded like oil pulling this or all natural mouth rinse that. You like the when you go down like the oral care aisles now, it is full of all of these things that kind of speak to these trends, especially, and I think it kind of feeds into like the social media age that we're in for people to try more products and promote more brands. Would you say so?
And I think the more the debate on fluoride goes on, the more and especially now with all the new evolvements, I think we will see a lot of new products. And as a matter of fact, the other day I saw one of my students from UConn that I happen to follow on social media that was promoting something that type of, eco-friendly, whatever, toothpaste that was fluoride free.
Those are all good things that we've introduced. Like, these are all things that you kind of see in passing, and then sometimes you go down the bunny trail and sometimes you're like, whatever. That's what I do. But I do want to make sure that we give our listeners some topics and some tactics to really counsel our patients on the misinformation that they also maybe buying into online. So can you tell us what's the best way for us to address this with our patients?
So for me, I like to give examples that they can understand. And for one, I try not to shame them or make them feel embarrassed for even believing this, because you want to be that trusted resource. But one of the things I like to tell people who really strongly believe about something they see online is I say, if you go searching online, it says that the world is flat. And then they realize, you know what, you're right. You can't believe everything that you see. But I like to bring it back to, the science. We know the science. So we can give them the science. I have examples. I have a patient who used charcoal toothpaste. She really did a number on her enamel and she was super sensitive. But to just bring back the science and the years and years and years of research that they just can't, years and years of research.
Yeah, very good.
I want to say one other thing. So I was going to ask about some of the products and actually some for you, Dr. Tricia. How does these conversations come up when you're in practice? I don't know that I have too many conversations. I think if I ask, so for instance, about fluoride, I'll ask, what is their perspective, or do they prefer fluoride or not? And then, I just became a practice owner. So then I have to take it a step further to be like, well, do I want to be a resource for the patients, or I don't want to lose these patients because I believe in, topical fluoride varnish and they don't. So then I'm like, okay, well, do I need to have some things to offer in the office? Can we talk a little bit about that? Maybe you can help me out a little bit.
Oh, yeah, sure. Because I do. I offer fluoride varnish in my office. And I'd like to say where my practice is, we have a lot of people who are eco-friendly, natural, conscious. And for sure, there are some people who will say, no, I don't want that because fluoride is a poison.
I mean, you are in Brooklyn, right?
Yes, I am in Park Slope, Brooklyn. So
Exactly. So you have these eco-friendly whole food moms that will come and say fluoride is a poison. And many of these people are very educated.
yes, for sure. Absolutely.
Otherwise educated.
Yes. Absolutely. So then I bring in information that they maybe didn't know or forget about. Like fluoride is naturally occurring in rivers and streams. And there are a lot of vitamins and minerals that are good for you. And in excess, you wouldn't want to consume it. But we're not talking about excess. We're talking about small amounts. So sometimes they can understand that, like, oh, yeah, that's true. And that's kind of how I do it. Something they can relate to and understand.
No, that's great. That's a very good approach. And as we mentioned before, I think it hurts us when we take the condescending route. You can never, communicate well your message if you look down at your patient or your, whoever, the friend, the public, thinking that they come from a, lower educational level. So I think it's really important to be respectful. And the way that you put it is really, really nice, because if you describe to the patients the levels of the dosage and how exactly fluoride is around us in the nature, they get a different perspective, I think, provided that people are open-minded, as we are.
I was just going to say, as long as they're open to it.
Yeah.
Yes. And all you can do is educate and say, hey, like, I'm here. You want to be that resource. You want to be the person they go to, not Google or TikTok or Instagram.
Yeah.
But yeah, you're right. There's only so much you can do, but you're here to educate so they make the best decision. And of course, we know sometimes a little bit more than them. So for sure, we're that research. We're the experts.
Now, it's difficult, though, to find misinformation online. I wish there was a special tag on Instagram or Facebook or TikTok that says, this video is not verified.
Yeah. But you know what I do is I encourage my employees who are much younger than me to look out for things that they're saying. To give us a heads up, all of these trends, all the dancing trends, all the dental things, it's like I have little scouts or people out there looking for it.
That's very
You can
wise.
always start following certain people who will have some of the topics, and then you'll start seeing them. Yeah.
Yeah, it'll start to show up like naturally in your feed.
Yes.
And then
algorithms.
It'll give you more insights on what kind of content to make to also educate more people who are following you, if you see some of those things.
Exactly. So I do the dancing as a way to bring them to my page, but then I hit them with the information.
Good. Yeah.
We will be right back.
Is it time for a vacation? Well, then anchors away. ADA members get member-only pricing on thousands of cruise itineraries from the biggest names and destinations in cruising. Experience the Mediterranean, the Antarctic, the Caribbean, and more. Visit avidtraveling.com/ADA and never pay full price for a cruise again.
ADA Member Advantage endorsed Best Card has saved dentists an average of more than $5,000 per year on credit card processing fees. Find out how much your practice can save with a free analysis from Best Card at bestcardteam.com/ADA.
Welcome back to Dental Sound Bites. Today, we are talking about the dental misinformation that's sprouting up and spreading on social media.
We have some input from Dr. Ashley Lerman, who is a pediatric dentist. She's going to share her experience seeing misinformation in her algorithm at her practice and how that translates to real life conversations with patients. Take a listen.
Hi, everyone. Thanks so much for having me. My name's Dr. Ashley Lerman. I'm a board-certified pediatric dentist, a mom, and founder and CEO of First Grin. So, as a pediatric dentist and a mom who's very, very active online, I've seen a lot of the myths, a lot of these tips fed into my algorithm, so it gives me a firsthand seat on what's actually going on. Some of the things that you see are DIY tricks and trends at home. A lot of them are driven by saving money, saving time. The gamut runs really far, but one that we constantly come up is homemade whitening solutions or homemade alignment solutions. So something that I've seen across TikTok is a hydrogen peroxide mixture that you make at home. As dental professionals, we know hydrogen peroxide at high doses can burn your gums. It can damage your actual teeth. It's poisonous at high doses when you swallow it. There are industrial cleaning solutions that people are rubbing on their teeth in order to get whitening outcomes. And then people are even turning to taking rubber bands to change the alignment of their teeth without any expertise. So these definitely have real life consequences that result in pain and can result in more damage than good, that result in needing to see a dental professional to undo what harm they've done. So when a parent asks me about a dental trend they just saw on TikTok, or a patient asks me, I try to lead with curiosity rather than shame or judgment. They're obviously doing this from a place of curiosity and wanting to do something for themselves for whatever reason. So they may not feel comfortable asking a dentist. They may feel stupid. They may feel embarrassed, whatever that may be. It's our job to listen and then offer a solution. It's also our job to educate a little bit. So I'll talk about two separate occasions. One that I see most commonly, unfortunately, is when patients try to shape their own teeth with a nail file. This blew up on TikTok. So I remember specifically a teenage girl came in who was unhappy with the shape of her teeth, the alignment of her smile, and she took a nail file to her canines, which are the sharp, pointy teeth on the smile arch, and shaved them down. She ended up having a ton of sensitivity, was really unhappy with how the flattened teeth looked, so she came in with her parents, and it was a longer conversation of, talking about TikTok, about unrealistic expectations, about aesthetics, and then making a path forward for what she ultimately wanted, what was realistic, and moving forward. And she was really, really happy once she got to a place where all of the expectations were managed and we were on the same team together. So when it comes to misinformation, I think dentists can really step up to the plate and have a really important part of the conversation. I think knowing resources, platforms that are reliable and trustworthy so you can point patients in that direction is really important. Urging patients to take a look at credentials, telling them how to know what's a trustworthy resource or what's just simply unsafe science. And also leaving the lines of communication open, because if a patient is curious about an approach, a trend, a technique, to have the dentist be open to hearing it and work together to get to the end goal. So if it is a whitening trend, a hack at home, have that patient go to the dentist and ask about it. And if it's not legit, then the dentist can propose better ways to approach it. I think a lot, if not majority of people are turning to social media to educate and to learn and to further explore topics and conversations. So I think as providers, as professionals, we have a duty to get the real science, real information, and trustworthy information out there for people. And that's how people are consuming it nowadays. So for all of us to step up, that doesn't mean making your own content, whatever it is, but again, being able to be aware of content that is reliable, pages that are trustworthy, so you can point patients in that direction and have that as part of the conversation as well is important. Thank you so much for having me on today. This is such an important and timely conversation with everything going on in the world, and I look forward to hearing more episodes in the future.
Thank you, Dr. Lerman, for sharing all this great information.
That was so good.
Yeah.
I wrote a few things.
Yeah, so many interesting ideas and communication skills that Dr. Lerman has developed, which is great. And I'm sure the pediatric dental population is even trickier sometimes.
Yeah, it comes back.
Tricia, what do you think?
Yeah. I mean, really, it's exactly how I feel, coming with curiosity. Patients are really embarrassed and ashamed. And I've seen patients that I've seen after they had tried the trend and it's after the fact and after the damage is done. And just, not making them feel bad and knowing that, hey, come to me first next time. I'm the expert. We can do this together, but it's definitely, coming from a place of getting the patients to trust you and wanting to come to you and approach you first.
What is the wildest thing, the weirdest, not the wild, the weirdest thing that you have heard?
Or maybe even seen inside of your practice?
Or your patients or social media, anything?
For me, it's interesting. It was it's a classmate of mine from high school who had a before and after picture of how she felt like she had reversed her cavities. And it was like number 8, and it was the hugest carious lesion. And it was big and it was dark, and you could see in another picture, it's a little bit lighter, but it's still there. And she really felt like she reversed it with oil.
Wow.
Or Photoshop.
This is true. Filters.
And and it looked, the lighting looked very different, but she is a natural practitioner. So she is very much pro trying to find natural ways to heal things. But I remember looking at it and thinking, wow, the caries is still there. It is still there.
I have a lot of holistic patients and a lot of eco-friendly patients as well. And so then I kind of double click into it and say, okay, tell me what products you're using, because now I want to learn. I feel like as a provider, I want to be more equipped so that I can have my responses ready, if that makes sense. Because a lot of the things that patients come in talking about, these are things that I have sometimes never heard of. And they're introducing it to me for the first time. And I'm like, you know what? Thank you for sharing that, because the next time I have this conversation, I'm going to be more prepared, so I haven't heard, and I think it's because of my most recent practice transition, because where I was working before, my patient population was very different. They were all terminal dentition. So we weren't having those conversations about how to save teeth and how to oil pull and any of these natural effects. But now that I've transitioned into my own practice, it is a completely different demographic of people. And so I'm having to re-educate myself and just prepare myself a little bit differently for each interaction. So maybe I'll have an answer for you, in a couple months.
Yes. And I'm sure that, your Florida location compared to Tricia's Brooklyn location, different demographics, right? Different ideas, different people, different, but also different misinformation. Misinformation exists everywhere.
Yes, it does.
It does. Yep. Just levels to it.
Exactly what you've experienced, I've experienced. So tell me use a product. I'm going online to find the ingredients. And I'm like, listen, look for things that are trusted. The ADA seal is still a thing. If not, it's really, products are products. I always tell my patients, they are on the shelves because people buy it. It doesn't mean it's good for you, right? Like hard bristle toothbrushes and things. And because they ask me at the time, why is it out there? And I'm like, because people buy it.
Yeah.
People buy it.
You're still consumers at the end of the day.
Correct. You're still consumers. I like to give people the mouthhealthy.org website, things that they can trust, not, Google. Google will have everything on there. Just going to trusted sources.
Yep.
Oh, that's right.
I was going to ask you a question, Dr. Effie. So from an academia perspective, do you ever have any students come to you with trends or anything like that you have to say, let me point you back to the science? You can put on your...
No, I haven't. No, interestingly enough,
okay.
No.
That's awesome, actually.
No, I think it's great. I have been as an academician in 2 dental schools, 20 years at UConn and now at UCSF. So no, I didn't have this type of interaction. And I think it's probably because as our students come from a strong, in all our dental schools, come from a strong science background, traditionally, right? And their dental education with some basic principles of biology, chemistry, thank God. And I think from the very first year, they are introduced to the, to the most common, I always say, the most common dental diseases, caries and periodontal disease, right?
Yep.
Like if you know how to treat this, you're most of our problems
You're on
are
a good
done.
track. Yep.
So you're in a good track. Obviously, I don't want to overlook cancer, and I respect very much all my oral medicine colleagues, but the most frequent diseases that we as dentists face in practice are these two, and then the consequences of this tooth loss, right? So I think that the students get start on the right foot. So no, I haven't. Now, going out to practice and being 10 years out, now they're out of our purview. I don't know what they are doing then. Like, there are many publications. There are a lot of companies. There is a lot of influence. Tricia put it very well. There are a lot of algorithms that you can, there are certain algorithms that can feed you the information that they suspect, they assume you like. So that's, I'm not quite sure. That's why I think that it's important for dental academia to stay informed as to what exactly the trends are and how we can prepare people to, people like, that's why I thought Tricia is like really an important guest that we had, because it gives us the connection to what exactly is happening now. And we need in dental schools to prepare people for what is happening now. We need to have faculty that are equipped. I'm not. I mean, I'm on TikTok, but for entertainment reasons, right? But we need to have people that really feel free, comfortable sharing and utilizing these methods to engage. Now, this is an idea that is happening as we speak. So maybe the three of us can come together, right?
The wheels are turning for me too.
But we're all equipped. We're all professionals. We have the knowledge. And sometimes it doesn't have to be a flashy video or something. Like, we have the knowledge. We are still the experts.
You are absolutely right. We do have the knowledge. But what you two have that I don't is the skill and the talent to communicate this knowledge utilizing channels that maybe my generation is not as comfortable as compared to you using them.
It doesn't have to be, I think, fancy and professional. I think patients and consumers, they like real and authentic. I think they appreciate that more.
Very true.
But the spin that I wanted to give to this discussion that we had is that it's important for dental education to be in this. To play a role in this, in all this, big social media, communication with the public, using plain language. I think this is really, really critical, in my opinion.
It is. I want to say one thing while we're still on the topic. I'm going to read this from a sticky note that I literally just wrote down. The question that I was going to ask, and you literally just answered it, was should we be looking for these trends and so that we are prepared to respond to them? And I love that you're like a fly on the wall. I think you're like inside of this room with me. You like read my mind, but this is so good.
Yes. And like I said, I like to find the younger person in my office who's already on social media to be the lookout.
I'm totally going to borrow that, because I'm not utilizing that as a strategy right now. I'm going to borrow that. So thank you.
So as we wrap up, do we have anything that we left out? Is there any bottom line?
I thought about something. You know what recently popped up that we didn't talk about? Mouth taping.
Oh, yes. Oh my gosh. A friend literally just texted me about how do you feel about mouth taping? Talk about it.
I think you should tape my mouth.
Sure. Yes. So mouth taping, I'm seeing it all over the place. There are products and people are mouth taping as a way to make sure they're not mouth breathing. They're breathing through their nose, which we know is a great thing. We don't like mouth breathing, but they're not doing it under the supervision of a professional.
Thank you.
And there are people who should not be mouth taping, those with sleep apnea. But the problem is just in general, there's not a lot of research. We love research, but the concern is that everything is do it yourself. And it's, a professional has not recommended that they use it. But mouth taping has definitely one recently I've been seeing all the time.
To promote better sleep.
Yes.
That's such a good point.
On the next Dental Soundbites.
A Dentist's Guide to the Law, Part 2. More answers to the legal questions dentists face every day.
We are picking up the conversation with practical insights to support you, your team, and your practice.
Okay, well, listen, as you all can see, to everyone listening and watching on YouTube, you can tell that we could talk about this all day. We have stories for days. So I think this needs to become a repeat episode. But anyway, thank you so much, Tricia, for sharing all of this information with us and allowing us to just take you on all of these winding roads and share our different stories. I think this is really good for our community of listeners. I know that we've covered so much, but is there anything else that you want to share with our listeners before we wrap up?
No, I think we've covered it all, really.
Okay.
But just, going back to research, science,
Yes.
statistics. I love that.
Yes.
Patients understand that.
Great. Short and sweet. Yes, they do.
And the biggest takeaway and the bottom line of all this, the tip that we need to have in our back pocket for addressing misinformation, would you summarize this? What would you say? Science and the right resources?
Yes, but more than that is that open dialogue and making sure that your patients see you as that trusted source, but that person that they can go to. Because if, you have to have that open communication.
That's exactly right. Thank you so much. Tricia, what a nice discussion we had. It was so nice meeting you.
Thank you. Thank you all.
So tell our listeners, where can they find you if they want to connect with you and learn more about your work and get inspired by your dancing videos?
Oh, yes. So Instagram and TikTok, it is the same handle. It is Noble Dentistry. So Noble Dentistry. And then my website is myparkslopedentist.com.
Oh, that's great.
Check me out, subscribe. I don't know how it goes.
I'll definitely check you out. I'll definitely check you out.
Thank you, guys.
To all of our listeners, we are going to link all of the resources and the information that were mentioned in this episode in our show notes on ada.org/podcast.
And if you found this episode interesting, please share it with a friend or more than one friend. Then be sure to subscribe wherever you're listening so you can get all the latest episodes.
And you all know it. Don't forget to rate it, write a review, and follow us on social media.
Goodbye.
That's it for now. Bye.
Thank you for joining us. Dental Soundbites is an American Dental Association podcast. You can also find this show, resources, and more on the ADA member app and online at ada.org/podcast.